Good morning, everyone. In our work, it's really very important that we have opportunities to convene, to connect, to brainstorm in person. And so I want to just say thank you to Jamila and the Institute for Women's Policy Research for hosting this fabulous event and for the invitation to attend. I really appreciate it. And hands up to Jamila for wearing that suit. She is doing it. So I am Chrishana Lloyd. I'm a social worker by training, so I'm in the caring and helping profession, but I am turned into a researcher. I attended college undergrad at James Madison University, who's named after our fourth president, who owned over 100 enslaved Black people. He even brought them to the White House. My master's is from Howard University, the Mecca, one of the most renowned historically Black colleges and universities. If you know, you know, right? Okay, it was created to provide Black Americans with access to higher education, a resource largely denied to us at predominantly white institutions and universities. Perhaps one of the most well-known grads currently is VP Kamala Harris. I then went on to University of Delaware in Newark, Delaware, after becoming very, very tired in my social work career as a carer, and from which our current president, President Joe Biden, hails. I am the descendant of enslaved people from South Carolina on my father's side, Henry Ivory Buck, who was a plantation owner's son, and Virginia on my mother's side. My great-great-great-grandfather, James Montgomery Peters, escaped enslavement and fought in the Civil War. Fun fact, his musket travels around the country. I'm also a descendant of those who did the enslaving. A reality of many Black people in this country is evidenced by the way that we present with our varied skin complexions, different facial features, eye colors, and hair textures. I also have some Caribbean roots, and we know the slave trade was big in the Caribbean as well. My upbringing is solidly rooted as a descendant of enslaved people and, frankly, colonizers in this country. I married a Black man. I'm a mom of a 13-year-old Black boy and twin boys who are 17, so there's lots of Blackness and testosterone in my house. Okay. One of my twins is disabled. He has cerebral palsy. He communicates with an iPad, he uses a wheelchair for mobility, and he depends on us, me, his father, his brothers, for his daily needs, and that includes eating, bathing, bodily functions like toileting and diapering and such. So I know caretaking. I know it professionally, and I know it personally. It is my life. And as a family, these are things that we discuss. They're beautiful, they're stressful, they're hard, and we've had many, many conversations about gender roles in a two-family household where both of us are working. So I share this kind of professional and personal background because it's important that you know who you're hearing from. It's important that you also understand that history is closer than you think, right? Just 3 generations back, I can trace my family to the enslavement of my people. It's also important because I'm a literal case study of some of the things that we're going to talk about today, the ways in which history, race, gender, access to opportunity, and resources have denied certain folks in this country care, and how it's been devalued because of our past. So I'm going to draw on these experiences. Thank you for obliging me and giving me that time. And my primary areas of professional study for over 25 years, early care and education, and Black families, as we chat today. So let's talk about the history of care in the US. This photo is of an American sculptor. He was born in Canada. His name, Mr. Dunbar, Ulrich Stonewall Jackson Dunbar. He was highly decorated for his skill in being a sculptor. And here you see him working on a scale model of a sculpture that was referred to as the Mammy Memorial. It was congressionally proposed. It was going to be located in Washington, D.C. by the Lincoln Memorial. We heard from Governor Pritzker about the home of Lincoln. Also an emancipator of enslaved Black people, to honor domestic workers in the US. The bill for its construction was introduced by a Senator, John Sharp Williams, he was from Mississippi, backed by the United Daughters of the Confederacy and Congressman Charles Manley Stedman, also Southern from California. It was discussed in the House of Representatives. It was received very favorably from Democrats and Republicans. And if you've been to DC now on the Mall, right, you know that ultimately the statue was not made. Black Americans condemned it, as did other groups, and since we're here in the Chi, I think it's worthwhile to mention that the Chicago Defender was very loud in protest about it. And also the Baltimore African American newspaper, who actually put forth kind of a satirical depiction of this particular statue with a Black woman holding a baby by the side, a white baby, head upside down like a neglected rag doll, with her hand out, standing on an upside down wash basin, wooden wash basin, saying, "In grateful memory to one we never paid 1 cent of wages during a lifetime of service." Okay? So as my kids would say, run me my money. Right? So the story of this narrative is important because memorials tell us what we value. They're permanent. And we've seen this figure everywhere. We've seen Mammy the Black woman on Aunt Jemima pancake mix. We've seen her on Gone with the Wind, and cinema. But this is next level, right? To really have money and funding, congressional approval for a memorial, to stand out in permanency, not for commercial purposes, not for entertainment purposes, but as a political effort to legitimize the domestic role and value of Black women on the ground in our nation's capital. And I need you to sit with that and really think about that. That was a woosah for me. Okay, and it occurred along this larger movement of building Mammy schools, domestic academies, right? So that's another conversation we'll have for another day. It's probably a university level class, really. Okay, so let's move on. So how did we get to this memorial? Like, what propelled us there? There have been centuries of US policy, beginning with the institution of chattel slavery, that has perpetuated the undervaluing of Black people. And when we talk about care, Black women, but also white and other women too. And these pictures, you'll see I love visuals, as many Black elders say sometimes, I can show you better than I can tell you. These pictures are telling a story. And the story is old, but it's really quite simple. And what we know is that American Indians of what is now the continental US had their land forcibly stolen from them by white European settlers. Africans were brought to America against their will, kidnapped to be enslaved, and white European women were transported to America to marry, bear children, and run households for white male European settlers. This time period, these actions solidified the role of women, and Black women in particular, as domestic workers, responsible for childcare, household management. This was all in the spirit of generating wealth for a select and a particular group of white men in England and America. So enslaved Black women, and men too, were viewed as property, mentally inferior, unevolved. Depictions of white women, as you see here, emphasize purity, chastity, domestic but elevated in their status as wives and mothers, right? And so these stereotypes were inaccurate, but they also helped to rationalize the poor treatment of Black women during and after colonization and enslavement, and they encouraged the exaltation and to some degree the restricted power of white women. Okay, so we're here today, right? And you see various pictures of caregivers. We got personal care aides, we've got home health aides, we've got nursing assistants, nurses, early care and education folks, social workers, midwives, nurses, right? Lots of people running around in the field. Beautiful work there. I'm looking at that top picture, that could very well be my son, right? And I know the work that that woman is doing and how hard it is and how underpaid it is. So now I'm showing you another visual here, and it's helpful and it's grounding. It comes from a set of resources that I refer to, and the field refers to in early care and education as the Mary Popper Papers. The words, the title is a play on Mary Poppins, with Popper meaning poor. And later in the deck is a slide of the cover of those papers, which is also a very powerful image. And there's a QR code if you're interested in looking at and reading the papers. But on this timeline, we don't have time to get into all the different policies listed on the slide. They're small, you can't really see them. But what's important here is that they lay out what's happened in this country. And they lay it out in a proportional way. So you can see the different boxes and the length of time on those boxes. And you see it's not until very late in the history of the country, about 75%, you see as the boxes start getting smaller, that's where we see policies that were more enabling and supportive of women in caregiving, and Black women in particular. This body of work focused on Native American and Black women, as well as women more generally. But but it's applicable, right, to other races and ethnicities too. All right, so if you really want to learn and understand the role that policy has played in care compensation, particularly early care and education, those are the papers to read. Okay, so what can we do now, right? How do we go from viewing Black women, as we see on this slide, as wenches, their children as pickaninnies, as mammies, being traded for money, white women as weak, in need of protection, and that's a nuanced story, which I'm going to talk about in a little bit, because white women yield a ton of power in these care places and in these care spaces, and we have to talk about that. I'm actually working on a paper now called The Cardigan Mafia to highlight some of these challenges. Yes, I know, right? But it's a challenge to coalition building, and we have to talk about it, and we have to get deep into it to really deal with it, right? And so we can talk about that later, but I will argue that there are 4 primary ways to address this issue. And we heard about some of them. Ann Price talked this morning about narrative shifting, lots of talk about research, which I do. Governor Pritzker, Senator McBride talked about changes in policy and intentionally and deliberately focusing in on equity to address the power dynamics that are at play, right? So lots of different things. I'm going to talk about creating and changing policy because we don't have a ton of time. Okay, and what we do know is that policy solutions work. And on this slide, we see 5 policy strategies that have taken place in the care profession that have been successful in addressing some of these issues that I've laid out. There are wage pass-throughs, which really are kind of increases in insurance compensation that are funded directly, those funds are given directly to caregivers, home health aides, personal care aides, nursing assistants. We've got wage floor increases that increase the minimum rate of pay that employers can legally pay an employee. The speaker before me, or the one before that, I think I was walking in the green room, can't remember who, talked about what's happening in New Mexico in the early care and education space, right? DC has done great work here. There are raises that are tied to workforce development and training. You get more credentialed, you get paid more, which, crazy enough as it sounds, doesn't always happen in our spaces, right? And one-time wage enhancements and value-based reimbursement. Value-based reimbursement basically says that you're compensating people based on the quality of care that they provide rather than the number of services or the people that they treat. Okay, the other ones are pretty self-explanatory. Right now, we've got about 40 states who are doing value-based, or launched a strategy, not doing it. 23 have established some targets, and 6 are actually implementing, right? So we've got a long, long way to go. The policies are not mutually exclusive. You can implement one, you can implement several, you can do them simultaneously, which is great, right? And for the most part, they really do have research behind them and evidence that shows that they work. The DC Pay Equity Fund is one that I really, really love. I am doing an evaluation of that along with some other folks from the Urban Institute, Mathematica, and it was passed in 2021, and essentially it's the first of its kind program in the US, and it aims to pay early care and education educators the same as K through 12 teachers. And also provide similar benefits, right? Phenomenal. It took over 20 years, if you hear Sarah Mead talk about how it got off the ground, and the important part is that it has a dedicated tax base to ensure that the monies are available in perpetuity. And I say that, but we also know this summer, if you've been following it, there was danger of it actually getting erased, right? Advocates, research, policymakers, right? Everybody kind of locked in, and we're A-okay, and we're good to go, right? But these are some of the policies that can really be helpful in addressing some of these issues. Okay, some other conditions or considerations when we talk about policy is that we really need to understand that though the policies have been effective, the wages for the care workforce, which we all probably know sitting in this room, lag behind other workers, right, that have similar skills, qualifications, credentials, et cetera. And we also know that equity is rarely addressed in any of these policies. Okay. So what does the research tell us about these issues related to equity? And I know I don't have much time, so I'll go as fast as I can, but there's work that was done in California on the early care and education workforce, and the bullets are here, very clear QR code is there if you really want to get more information work done by the Center for the Study of Child Care Employment out of Berkeley. And essentially, white educators are more likely to be in leadership positions, regardless of their education levels. You see here, Black educators are overrepresented among family child care providers. That's for a number of reasons, some of which is protection for our children and ourselves. But they're more likely, when you're in those environments, not to have access to resources and supports. Black and Latina educators are disproportionately employed in lower paying positions. Okay? This happens across job roles. It happens regardless of credentials, right? So this is a big, big problem. And we see here these gaps in the wages, et cetera, right? Importantly, that last point is not because of differences in education levels, location of employment, skill set, whatever. And in fact, if you're Black, you've probably heard this a lot. If you're Latina, you might have heard it too. If you're Asian, you might have heard it. You have to be twice as good to be in the same spaces, okay? All right. So what do we need? In my 1 minute and 30 seconds left, we need to more focus on equity, right? We're starting to hear about policies that are really important and helpful for the care economy, the care workforce, but equity is off the table. Those findings from California, I look in my own work environment, at a think tank who does research, and we're dealing with and struggling with some of these same issues at my organization, right? We're a microcosm of society, and so we really need to be thinking about race-based, equitable policies to address some of these issues. And it's a hard sell. We see the rolling back of affirmative action. Fundamentally, people will think, oh, that means you're lowering the standards and the quality. I've heard that in my own work environment, said to my face, and then someone reaching out to ask me for help and support on things that they need. But I'm inferior, right? So we really need to think about this, and we really need to talk about this, and we need coalition building with shared power between white women and other women of color. Those reins have got to be loosened up. We've got to be deemed equal. We've got to be sitting at the same tables. I listened to Governor Pritzker, and he was talking about his mother and those marches, right, and the civil rights movement. What he didn't talk about and share, and that's not to diminish the role, is that Black women were asked to be at the back and also asked not to march because it might mess up the effort, right? Okay, so we really need to talk about and dig into some of these issues. The research that informed this presentation, the Mary Popper papers, which I talked about, QR code there, the visual, 100-year review of research on Black families, my other side of the coin of work that I do, all very relevant, and they are saying goodbye because I'm about to get the hook, right? So thank you very much for your time.